We studied a lot about arthroscopy, where we also spoke about arthrography, that's imaging of joints. Arthroscopy being all those joint surgeries, okay? So we read about the joint surgeries. It had a lot of complications, but two complications caught my attention. That's hemarthosis, which is what? Bleeding into the joint, and thrombophlebitis, which is like blood is actually clotting in veins, okay? So this could be a complication of what? Knee surgeries, joint surgeries, right? It could be the knee, it could be the shoulder, and the rest of it. So arthroscopy, you should know that what? If it is done rightly, by the right person, it's generally safe. Do you understand? But two important risks include bleeding into the joint and also vein inflammation. So the vein, this is what? Bleeding into the joint. Then here, the vein is getting inflamed and blood is also clotting. So you're having deep vein thrombosis. Okay, so let's look at how it comes about. So first of all, the bleeding, there's accumulation of blood within the joint space after a joint surgery. Maybe injury to the intra-articular vessels during the procedure, or maybe after the procedure they gave you some anticoagulants. So anticoagulant drugs are drugs that will prevent blood clots. I don't know if you understand. So they are giving them to you. They can actually tilt you into what? A state where your blood is not clotting well again. So clinical features, there will be pain, there will be swelling, warmth, reduced range of motion around that joint. The joint feels tense and distended. So you manage it from what? Aspiration of that joint, the blood from the joint, compression, rest and ice, address any underlying issue. Okay, if it is a drugs, you have to withdraw the drugs and all of that. How about thrombophlebitis? It's a venous complication, right? So there's inflammation of the vein. So of course, the vein linings, that's the walls, are getting rough. So there's now risk for blood clots. Okay, usually in the lower limb. So probably it's from venous stasis, from limb immobilization, endothelial injury during surgeries. Hypercoagulable states. All right. So there's pain, there's tenderness, there's swelling, and it may progress to deep vein thrombosis, just like I was saying. Okay, and those blood clots could actually break up, travel to other parts of the body, and even block them. Do you understand? So it manages with anticoagulation therapy, compression stockings, limb elevation, mobilization, and for early mobilization afterwards, arthroscopy. Okay, the prophylactic anticoagulation. Okay, in high risk patients.